Barbara Courager.
Thank you, Mr. Speaker. It's a pleasure to be taking a call this afternoon. I'm really proud to be part of the Health Select Committee, and it's really pleasing to note the $15.9 million record budget. And you know, the key thing about this is that National believe all New Zealanders and their families should have access to timely, quality health care no matter where they live. And a really key feature of the estimates going forward is actually putting things into medical services that are much closer to home. And it is important for people to be close to home. And if we think back a few years ago, we were having a woman with breast cancer going to Australia. That is the most stressful time for a woman, and it is so important now that they are able to have that service in their country and in their community. And I'm really proud of some of the things that are happening to take the services closer to home. And even in the last few days, we've seen some announcements that have come out around these estimates. So not only are they estimates, but they're actually falling into action. And one that I'm really been pleased to be part of is the Mobile Surgical Services contract, which has been extended. Now that's a great bus that to date has actually gone around, and approximately 20,000 New Zealanders have been treated on this bus and received over 45,000 hours of education. So not only is it actually treating the patients, but it's actually, we're going around and actually educating health professionals on the road. And what it's done is it's reduced the waiting times for patients and improving access to health for those people in rural and remote communities. And it was really interesting because in renewing that contract, there was a review prior to renewing it, and the professional development training provided to health professionals has been described as relevant and engaging. And the interactive digital video equipment enables collaboration with health professionals in other parts of the country and overseas. So not are we only training people on the spot, actually collaborating between various areas of the country, and we have links into overseas where people can share information and understand how to do it better. So I'm really pleased that 24 rural towns are actually receiving this service and will continue under the proposed health estimates to receive this service in a 5-week cycle where more people can have access. And it's also really important that an extra 846,000 is now going into 20 more nurse practitioner trainees. So currently there's 145 nurse practitioners in the country, and I know we were doing some work looking at some legislation last week where we spoke about changing some of the legislation so that we could give wider roles to some of these nurse practitioners, because up until now there's been the prerogative of the doctors to be able to do things that highly qualified nurse practitioners are able to do. So then again, we're working on this whole theme of closer to home, having more people out in the community. It means people don't actually have to always travel to the bigger hospitals, and it also means that some of those people in the community can upskill themselves to become nurse practitioners, which means they don't necessarily always have to travel to certain points in big hospitals either. So health is actually one of the future things, is actually creating it closer to home for people, and I think that's a really important thing. It's also working on the elective surgery. I mean, so far 37% more elective surgeries, so that means 44,000 people up until now, and we're going to continue to work on this in the future. It just means that those people don't have to sit around and wait for these operations, and I'm really pleased with that. The Minister mentioned that we have the up to 13 people being able to get to the doctor free. That means that they'll go sooner, that they'll get diagnosed sooner, which means the chances of them being hospitalised when they do go is going to be less. So that actually means that they will end up being closer to home as well for more time with their parents. And also up until now, you know, the tracking about children being fully immunised, 94% 94% of 8 months old are fully immunised, and that means that we're on track for 95%, and really proud of that. So thank you, Mr. Speaker, very proud.